Hey, practice owners, we are back for another edition of Coming Back Stronger. Our guest today is an old friend of the Profitable Dentist magazine, Ali Oramchian, HR for Health. And he's one of the guys that we turn to for advice, articles, content, speaking on kind of the HR side of your dental practice, which right now has become something that, maybe used to be a necessary evil. Today is a just off the chart. You have to become an HR expert, especially in the last 2 weeks or so. So with
Yeah,
that, Ali, how are you?
I'm good, Steve. I'm good. Thank you for inviting me today and looking forward to reconnecting. It's been a while since I've seen you.
Yeah,
I missed you.
I remember. I can't remember. I think we were sitting in an airport. Probably we were sitting in an airport somewhere. I'm
Yeah,
sure.
absolutely. Yeah.
Um,
Yeah, those days are long gone.
Yes, they are. I heard, in fact, I read an article. Who is it? Warren Buffett
hmm
is, getting out of the airline business.
I know.
And because of this, he says this is going to be the way that we communicate. And well, I agree with that. I was supposed to be in Hawaii 2 weeks ago.
Yeah.
I'm not going to Hawaii on Zoom. So,
No. Yeah.
we're still flying. But like any industry, it's going to change.
hmm
Dentistry is no different.
Right.
I think the docs who are sitting at home thinking, oh, as soon as, Trump or my governor sends me the text that says, okay, we're going to flip a switch and, go back to where we left it.
Yeah.
And that's just not, that's really not possible. So part of the context of what we're doing here, Coming Back Stronger, is to get those practice owners,
hmm
86% of whom are dentists and who weren't trained for this,
Right.
don't have the education experience and don't want to do it.
Right. Right.
But they have to sort of give them some advice and tactics on how to do that. And we were talking beforehand, you gave me a list of some really sort of key important things to touch on. And one of them really just starts out with how and when to bring your team back, which
hmm
is a whole lot of, a whole lot of questions. So
hmm
maybe that's a good place to start, you think?
Yeah, no, that sounds
Okay.
great. Yeah, and you're right. It's a strange time for us all because there's this kind of this excitement about reopening,
Mhm.
and different states are doing different things, but there's this definite energy that's building of and I think people are starting to realize that it's going to change. It's going to change, and we're going to be able to open up. But like you said, there's a fear attached to it as well, which is, what do I do? Is it do we flip on the switch and we're back to business as normal? And the answer, unfortunately, is not. Everything has changed in our society, and the forms that we need for our employees. We've been talking about this for years, but the reality is that now is more important than ever to make sure that your HR house is in order, because of all the things that we're going to talk about today. There's a lot of things that just need to happen, and the average number of documents, Steve, that you need to have across the country is somewhere between 12 to 17. So that means that there's 12 to 17 documents that every employee at your offices needs to have. And so if you don't have those, if you don't have an employment manual, just use this downtime to get that stuff in order so that when they do come back, it's one less thing for you to worry about, because there's new rules regarding discrimination, there's new documentation stuff, OSHA things, that are coming out because of COVID-19 that needs to really be documented and be ready for our first day back.
What are a few of those documents that, and again,
Yeah,
I think a lot of practice owners just assume, they're the owner technically, but they want to
right,
see patients and Mary Jane takes care of all that.
right.
Well, today it's probably smart to at least know. So what are some of the
Yeah.
documents that they really should, maybe in a list of priorities, they should make sure they focus on?
Yeah, I mean, the basic ones are the same, although they've been updated a little bit. So the W-2, the I-9, the sexual harassment information sheet, those are kind of the core, initial ones. There's some federal ones that are, some additional federal ones that need to be required. There's some state ones, but the anti-discrimination policies that now are becoming, required, a lot of people don't even have them in their employment manuals. And so those need to be kind of implemented now. But what I would say is making sure you get all the federal documents, making sure you get all the state documents you need, And sometimes, depending on what state you are, those vary greatly. And then making sure you've got an updated employment manual for 2020, because this is just it literally is a whole new world.
Well, so maybe here's a question. Am I hiring so we might have laid them off, we might have furloughed them, maybe that's the same, maybe that's different.
Yeah.
Maybe, whatever we call this thing, am I hiring my employees back?
Yeah, great question.
Okay.
So you hit it on the head. Everybody falls into two groups. They either terminated folks or laid them off, right? So that's the first category. And the second category is they furloughed them. So here's what we would recommend. If you've terminated or laid off your teams, members at any point during this crisis, then you need to rehire them back as if, they were brand new employees. And so that means you give them all the forms again. You make them sign the employment manual again. You go through the whole policies. You tell them about their hours. You go through the whole thing as if they're brand new employees, even if you had old documentation. And the reason is because it's just good practice at this point, because they've been terminated and you've done all those things. And so just hire them back home. So there's no question about that. If you furloughed them and they've been just home waiting to come back, you don't need to give them all the documents again. Steve, the only time I would say to do that for the furloughed employees would be if you don't have the 12 to 17 documents, or you have a very old employment manual. Just use this time to get it, to do it right with them and just update their documents. And so, for those clients of yours that are on HR for Health already, this is very easy. It's just a couple of clicks on our system and everything. They get everything electronically. The employees review it at home. They sign it electronically, and it all comes back. If they're doing it the old-fashioned way, they don't have HR for Health, then they'd have to get it in paper or get it emailed to them. Make sure that everything is done correctly. Have it be stored, in sort of a file under lock and key. Those kinds of things. But either way, it's a good time to sort of update the documents.
When you do the way you do it, if I'm not mistaken, it's all online, right? So
it's all online
there. So, again, if I don't know, if the worst happens, my practice burns down, all my documentation is still there. I'm still good to go, which is I think a lot of times what a practice owner might not think about. You have a file stuck in a cabinet underneath a drawer, behind the refrigerator.
Right.
If something happens, that's where we go get it. Plus, there's no checklist that says make sure you have this, 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 and this, and which you're going to need.
That's right.
Right now, a lot of them aren't going to want to come back. Or let me ask you this. Let's back up. Maybe what if they don't want to come back?
Yeah.
Or you don't want them back? Let's start
with,
what if, is this a good time? Can I do that?
Yeah. And this is a frequent question we get. I'm glad you asked it, because we get this hundreds of times a week, which is, what if I don't want everybody back? What do I do then? Right. Which is very normal during this time. And if when we spoke at your event a couple of years ago, I don't know if you remember, but you probably heard me say that, we always have to be careful about terminating people who are in certain classes, because we don't want to discriminate against them when they terminate. Well, there's this whole thing about, discriminating in hiring, which is, are you hiring based on some sort of bias, or are you rehiring based on some other metric? And what we're telling all of our clients is make sure that you have some sort of rational basis for the hiring. So whether you hire somebody based on tenure, right? They've been with you the longest, so you're going to hire them back first and then everybody else. Or it's on performance. I'm going to hire my A team, my rock stars first, and then I'm going to bring everybody else back. Now, the reality is that if there's a rational basis, it's hard for someone to say that you are discriminating against them. Now, if there isn't a rational basis, then it starts to become a little bit tricky if you have you fire only the older employees and you've kept all the younger ones, or you've kept everybody except the pregnant employee. So those things can cause some problems, and we think there's a lot of things coming down the road once everybody opens up that this is just one stress that you just don't need. So.
And as you're hiring back, I mean, maybe that is, dentists, as I don't like to generalize, but as a group, and I will, they don't like conflict.
Right.
So I've seen docs who will keep somebody on payroll for, Holly, it could be years.
Yeah, right.
They don't like them. They don't want it, but they, and they're afraid if I fire, Mary, then Jane's going to go and so-and-so go.
Right.
You kind of have a blank slate right now if you've done,
do.
if you've terminated them. And the other thing is, when you started your practice, and I've had people say this, think of it as you're starting over. You didn't say, okay, we're going to start with 100% everybody here. You can bring them back incrementally, and that might work itself out. So you kind of have an opportunity here to clean up a little bit, don't you?
Oh, Steve, absolutely. Absolutely. It's a once in a lifetime type of opportunity, because even though I think there's going to be a lot of pent up demand and there's going to be a lot of patients wanting to come in, the reality is that we're going to be potentially limited by rules that we don't know yet, that may limit our ability to see the same number of patients that we normally saw in an 8-week period, with social distancing and with all these other things that you have to do. So like you said, the demand's going to be there, but the number of patients we see may not be there. So it might be a good idea to, at least communicate with your team, and maybe some of them, like you said, need a job and they go find another office where they can work. But you're right. It's dentists don't like conflict for the most part, and they have good souls and they have great intentions, and this is a time to kind of fix the office, if you will.
So so we're coming back, we'll say, and I got the all clear, I got a text from my governor, and we're going back, and it's going to be 2 weeks from now.
Yeah.
And I've got a PPP loan sitting out there, and the clock's ticking on that. You got any advice on kind of office versus clinical staff? Is it okay for me to bring back maybe an office manager and some administrative people to start getting that part of my house cleaned up before I bring back hygienists who won't have any work to do? You don't want to bring people back it's okay not to bring them back if there's no work, I guess. So Work on your office staff and then ease into your clinical staff. You got any thoughts on kind of a strategy to do that?
Yeah, no, I think that makes a lot of sense. And I think you've got to do it by need. And a lot of people are focusing on their business systems, like you just mentioned. They're focusing on their business systems because they've been, they haven't had the time to focus on those in normal days because the office has been busy and everyone's, working hard. But now, there's some additional time. And so one of the recommendations we have is if you have any system that's broken or that's not as good as you want it to be, spend the time now to fix it. Have your team come back following the social distancing rules and the PPE stuff, and have them come back and start working on it. Now, once you decide to open though, there's a lot of things before your first day that I think the whole team needs to be together on. Like one of the things we're recommending is make sure, you're teaching them how to put on, use, and take off their PPEs. Right. This is something that no one has had to do before because, what dental office do you know that was using N95 masks before, right? It's people know this is true. It was a kind of an OSHA nightmare, but, for most offices, people were going, operatory to operatory, patient to patient without changing their gowns or not even putting on gowns, just having scrubs. But we all kind of look the other way from an infection control perspective, but now you can't, right? You've got to have gowns over your scrubs, and you've got to show your team, how do you take that off when you go from operatory to operatory, right? And patient to patient. So those trainings I think are really important. Training them on symptoms. What are the COVID-19 symptoms that we all know about, right? Start to identify those, because one thing, Steve, that I think is really a risk that thankfully, and God willing, it won't happen, but I know it's coming, which is that if an employee or a patient gets sick and they have to close the office, then, depending on which quarantine method you take, it might be 14 days, 21 days of quarantine that, the office has to go under, and which means doors are closed and all that kind of stuff, right? So
that's an expensive reaction to this.
yes.
That's 14 days of closing down at, if you're a good sized practice, 10 grand a day. I mean, that's an $80,000 to $100,000, hit.
100%.
Just for not following your own protocol.
Right.
So while you were talking, I wrote down another question. I have, in a couple interviews, I've had people realize that the way we work is probably going to change.
Mm-hmm.
And again, we don't know what that's going to be. But for example, my wife works for a very large Fortune 100 healthcare company.
Mm-hmm.
They call it agile. She's been agile for 3 or 4 years.
Right.
And that means she works where she is. So she's at home. She might be on a plane. She might be at a hotel traveling. Wherever she is, she's working, because the nature of her work is all, computer and communication.
Right.
She's done a cajillion Zoom meetings, if that's a number. This is nothing new. This is how they communicate. In fact, she did a Zoom meeting the other day that she did a presentation, and there were over 1,000 people on it.
Wow.
No, that's just how she's worked sort of in the corporate world. Well, in the dental world, we never even thought of that. Like, it wasn't even in our realm of, possible. But really, when you think about it, the person who is doing your insurance claims and on hold for 3 hours, you can set them up a little voice over IP phone number, and it looks like they're in your office.
Totally.
Call comes from your office. At some point, somebody's going to say, we have 3 of these people working. Why do they have to drive in here? So for them, they're thinking, you just saved me a half hour of commute each way every day, 5 days a week, and then fighting traffic and getting home. And, so there's a lot of, I think, efficiencies that just grow into this where that happens. And people say, we don't need that person here. They can work just as effectively somewhere else. So my question is, if that's, and number one, that's an employee, but sort of the B part of this question, Ali, is what if they're not? What if they're a freelancer that says, hey, I do this really well, but I'm going to do it for 4 docs in my town, you, and you. So maybe I'm a 1099er, and I work from home, and, you give me your AR and I'll return this much of it and get your claims filed. So they have a measurable and a result. What kind of can of worms does that open up versus they show up, we fill out some paperwork, and they're coming in here every day?
Yeah. No, there's so many interesting things that you just mentioned, Steve, because you're exactly right. On one side, there's a certain efficiency with what you just described, right? You have someone who, maybe, can now become their own business owner, right? They used to work for a dental practice doing insurance, and now they're working as a small business for 5 offices, 10 offices, who knows? And we are starting to see that actually right now, where some consultants are hiring these insurance coordinators from dental practices and basically saying, look, we'll give you this much salary. You'll have 5 offices, and you do all their insurance claims, and you can do it from home. Right? That is pretty incredible. Now, obviously, it saves the office a bunch of money because they're splitting basically that person with someone else. They have extra, office space to use for different things. The risk, I think, is if you're going to do it yourself, meaning your team is going to stay home, then you need a work at home agreement. And our law firm can create that. But basically, it's like a contract that you and your employees come to an agreement on, where it says, here's what I'm going to do. Here's how I'm going to safeguard the data, right? Because HIPAA, still applies. So it's all those little things. And then there's an agreement about workload and what you're going to do and what your responsibilities are and things of that nature. And I think that's not something dentistry is used to, but something that eventually we will be going to, for all the reasons you mentioned, because there is certain efficiencies that come out of this. I'll be honest. At HR for Health, we had an office, all of our team members were there, and now they're all at home.
Mhm.
And we're thinking, well, how do we bring them back? Do we not bring them back? We have people who commute over an hour sometimes,
Right.
because we're in the Bay Area, right? So it's a good problem, but it is, it is something that you have to strategize about in dentistry. What I would just say is, as a practice owner, if you're going to let people work from home, make sure you have a plan for it so that you don't run afoul of the HIPAA rules.
So that would be a thing. That's what you guys really do. And so I'll kind of tee that part up instead of, but these are things that you don't say, great question, Dr. Smith. That's form 52B.
Right.
These are things that, as these sort of new normals and new opportunities come about, you do need to pay a professional is what I'll always say. Pay somebody who does it. This is all they do all day long. That's the right person. Your brother-in-law is probably an awesome lawyer, and he'll work on your will and that kind of thing. But this is your business, and you don't want to expose that. Yeah, HIPAA. I guess HIPAA would be huge. And I know the my wife has whatever the security between the company she works for and home is very complex.
Yes.
And she has to accept something every time. But yeah, you've got lots of patient data leaving. That's not to say not do it. That's just to say, I don't know, 5 years from now, it'll be clicking a button. Today it is smart, but you're going to have to figure it out as you go.
Yeah, that's right. And like you said, it's not about not doing it. It sounds, when we and I talk about it, it sounds more complex than it truly is, but it's very manageable, right? I mean, at the law firm, it's a couple of contracts, right? At HR for Health, if you get on there, everything's automated, so you can keep track of them from a distance. And then, like you said, some very easy technologies, right? You put a desktop, a monitor with a laptop, like you and I were talking about earlier, and suddenly somebody's up and running. It's not that difficult.
And it works for both people. I think that's the neat thing. And not only that, but number one, you get at least the result you were getting. But what I find in a lot of cases is you get better results, more results. My wife will tell you she works more working from home than she worked driving, 30 minutes to downtown.
I believe it. Yeah.
She's finished at the end of the day. She goes in, she checks her email. She just wants to be ready for tomorrow. She'll answer a couple of emails that she wouldn't have seen until earlier. Plus she's eaten up the beginning and the end of each day. So I think those things will come about. But I always say there's, I'm not saying not to do it. I'm saying not to do it the wrong way.
That's right. That's right. Yeah. And I think you hit it on that. It's not right for every position in a dental practice, but there are some, positions where this could work out. But again, you have to have sort of a plan of attack. And right now, I think as we all are trying to figure some things out, if communication is a big part of this whole COVID-19 epidemic. And so if you are getting ready to open up and you speak to your billing coordinator and she's 62 years old, for example, or she's 32 years old, but she's just scared of coming back, well, this could be an option, right? You don't want to retrain somebody. You don't want to fire them. You don't want to do anything, and it's like, this might be an option for you to allow that employee to have a better life, be home. And for you, you're getting the job done. And as long as they're getting the work done, that's what matters, right? Whether they work 8 hours in your office or they do the same work in 5 hours at home, they're getting it done. And I think that's the key. And I'll tell you, one of the feedbacks that we got there, there's a couple of companies that, very early on recommended that people fire their entire teams, like on day one. And we were always against that, Steve. Sometimes you have to do certain things, of course, but I'll tell you, the backlash that I see, coming from that now, that people are starting to think about reopening, is starting to rear its ugly head. And the way we're telling our clients to combat it is communicate. Just tell them you made a mistake, and tell them you got bad advice, and tell them you really appreciate them and you love them in a non-HR violation type of way. You love them and you want them back, and that will further your goals so much more. than just assuming that everyone's just going to come back.
Yeah, I mean, seriously, as an aside, I'll watch the news and it'll say, we're talking to this person and an expert. And, Ollie, I've asked, who's an expert? I mean, how did you get to become, I mean, have you,
Right.
have you been through more pandemics than anybody else on earth? Have you been through more complete economic shutdowns?
Right.
How do you get to be an expert? And and so I think there are a lot of experts who really were giving their opinion,
That's
but
right.
literally nobody's lived through this. Nobody on planet Earth. So
that's right.
It's okay to say, you know what, we listened to these people, we got some guidance. Now that as things have evolved, we should have done them differently. We can't go back in time, but here's what we can do going forward.
That's exactly right. That's exactly right. Yeah.
So is there a risk? So here we are, we're at week, I don't even know what week it is.
I know.
But we're a bunch into it. We've gotten over the initial shock. We've seen some collateral damage. We're now we can come back. In Indiana, they were back last Monday. Kentucky is another Monday.
Mm-hmm.
Michigan, I don't know what's going to go on in Michigan. That there's a lot of that movement, but we know we're coming back. Is there a risk, and what would it be of coming back? And I don't mean health risk. I mean, as HR wise and legal wise, of bringing that team back too soon, and what's that look like?
Well, so the question I think really is, are you ready to bring your team back? And we are advising our clients a couple different ways with regard to this. One is we're saying, start the conversation first, one-on-one, get a sense of who wants to come back and who cannot come back, whether it's fear, their child care situation, their spousal situation. Maybe they're taking care of an elderly parent that you didn't know about, and now they don't want to expose themselves. I mean, there's so many different reasons, right? And so pushing people to come back immediately as soon as the doors open, there's a real risk there, because the problem is that you may not be ready for your team with full PPE, with the plexiglass in the front reception and the hand sanitizers and all the stuff that we know you need, those basic stuff that we know you need. OSHA is going to come down with a lot more, but the stuff that we know right now, right? Are you ready? And the problem with bringing people back too soon, too fast, or forcing them back, is that if you're not ready for that, if you don't have HR protocols in place, you don't have you don't have those things ready for them. Like one common one that I'm hearing now is these antibody tests, that they're recommending. Some doctors want to take, administer those to their employees. And we're saying, look, you've got to have a healthcare professional do it. If you want to take their temperature, great. Everyone's temperature should be taken before they walk into the office, right? That's generally accepted, and it should be documented and all that. But now if you want to do any other kind of testing, you got to have a professional do it. And if you don't do that, then it could cause other problems. So we're just cautioning, don't force everyone back. Have a dialogue, see who the volunteers are, maybe start with the volunteers, and then kind of build on that. And the more information we have, and the more PPEs you have, and the more your office protocols are in place, the safer it'll be to ask employees to come back, even if they don't want to come back.
So we have CDC, we have ADA, have guidance from ADA, we have guidance from the, Minnesota Dental Association.
Department of Labor.
And I think what I'm hearing is that, pick worst case scenario, follow that. And worst case scenario doesn't say you need an N95 mask. It's just that the N95 mask kind of covers that. But there are other options. Right. So if, as a practice owner who wants to open and you can't get an N95 mask, doesn't mean you can't open.
Right.
Now you've got to get creative, fulfill the guidelines as you see them, and, do your duty And I think that's probably a term maybe you can elaborate on just a teeny bit, is your duty to employees, your duty to your patients.
Hmm.
You have a duty to protect,
Yes.
but that duty doesn't mean, do A, B, C, and D unless some governing authority says to do it. But right now, I think most people are filling those guidelines pretty well. And
Yeah.
can you spend a minute on that? Just kind of explain. I know that's an odd bouncing around question, but
No,
just
no, no, no.
practice owner, what is my duty and how do I fulfill that?
Yeah, no, your question is spot on, because basically the duty is very simple. You have to keep your patients and your team safe,
Okay.
right? And how do you do that? Well, to your point, right, the CDC came out very early on and said, okay, every healthcare professional, you need an N95 mask. And then suddenly it was like, oh, wait, what?
Right.
There's no N95 masks out there. and then it was like, okay, so let's back off of that. And now you can have KN95 masks. And then it was like, oh, wait.
Right.
There's none of that either. Okay, so then,
yeah.
Yeah. And so they kept backing off. Now, what we know is that they've said some really interesting things. They've said, due to the shortage, you can have an N95 mask, and technically they're supposed to be disposable, but if you need to reuse it because you don't have enough, well, put another mask on there, right? And then take off that mask as disposable, but your N95 just remains, right? And so you're just kind of like a gown and a scrub, right? You put a gown on top of your scrub, you take off the gown, you take off your mask. Then they said, I think about a week ago, Sunday night, I think they published this. They said, if you've got expired N95 masks, that's okay too.
Okay.
Which is really interesting, because basically what they're saying is there's such a shortage of masks that they would rather people use expired N95 masks than to discard them for, cloth masks, right? So like to your point, I think everyone's trying to figure out what they can do to best protect the public and the employees. And if you're a dentist right now and you don't have N95 masks, you've got to make some really hard decisions. Do you stay closed until you get your hands on some and then figure out a plan, right? Do you call everywhere and anywhere you can and try to get your hands on something before you open up? Or do you open up with whatever you do have, trying to minimize the exposure to your team until you can get your hands on something that you feel warrants further protection? Now, there's hot spots and then there's hot spots, right? You're in New York City, you're probably not going to open up without an N95 mask, let's be honest, right? You're in, South Dakota, where you've only had a limited number of COVID cases, you're probably going to open up, right? And by the way, I use that as a real example. Here in California, in the Central Valley, there are towns that have had 1 or 2 cases only, and the dentists there are opening up with very little protections, because they're saying, look, there's only a few cases. We think this is enough for our community, right? And that's a decision people have to make. So
by duty, I guess somebody, and I've owned businesses my whole life, and long time ago, I might have been in college still, and had a friend who said, and I don't even remember the situation, but I remember him calling it the witness stand test.
Yeah.
And you imagine something bad happened, you're in charge. That's where I learned duty. You have a duty to protect every employee, even the idiots. And you've got a duty to protect patients, even the ones who don't listen to you.
Right.
That's not the important thing. He said the important thing is, imagine you're on a witness stand and I'm the attorney for the other side, and I say, what did you do to protect my client? And you better have something to say. So if what you say is, well, we decided this 6 years ago, and that's what we've been doing, and that's fine. Well, that was awesome, except we had a coronavirus epidemic in the meantime.
Sure.
What did you do in that case? Well, I don't know. Let me ask Mary Jane, the office manager. You don't get to do that.
Sure.
She doesn't own it. Let me ask it. So what I've always been the kind of person to do is look and say, all right, I'm going to gather my details. CDC says this, like we said, everybody who says this. So I'm meeting all those guidelines the best I can. So if somebody asks me, here's what I did. I did this, and this. Thought that was good enough. So did most of the dental population. They thought that was good enough, and it worked. And I think that's that. So I think the dentist mindset, as opposed to the practice owner mindset, the dentist mindset thinks they need a checklist from, the ADA, and until they have it, they can't open. And just your opinion, I think you can open, but again, you've got to be smart about it. Whatever, and we're talking PPE. This applies to whatever you do, but you have to demonstrate that you've thought it through. You took some actions, even if you took the wrong action. There's a lot of things that are a lot of trouble you're going to get out of by at least doing something to show you think you're doing the right thing.
Yeah, no, you're exactly right. You're exactly right. That is the perfect test. Is can you stand in front of a judge and jury and really make your case as to why you did your best?
Yeah.
And in a perfect world, we'll all drive 65 miles an hour. We always wear our seatbelts.
Right.
We don't smoke. We don't drink. We don't eat fatty foods. We don't do anything wrong, right? But this is not the real world, and there's a lot of things going on, and we need to do our best. Now, again, in an ideal world, you do that, but in the real world, you just have to kind of make some compromises. But like you said, I don't think ADA is going to come out with that. I don't think CDC or OSHA is going to come out with a report as comprehensive as that. We were hoping for something last week, but I just have a feeling like it's not coming.
I think they're going to do the same thing. They wait till they get the science, and that might be 6 months. It might be a year. It might be who knows.
Right.
And if you can wait that long, great, but your team's not waiting that long.
Right.
So,
right.
Speaking of team, so what if you have a team member who really is fearful of coming back, and you say, listen, here's what the CDC said, I'm doing that. Here's what the ADA said, we're doing that. Here's what the state of California said, we're doing that. And they are, let's start with, because I think there are a couple. There are some that are legitimately afraid, then there's some who have kind of an ulterior motive. But legitimately afraid, how would you discuss that with them? And what are my responsibilities as a practice owner there?
Well, I mean, if you have work available, right? If you have work available and somebody refuses to come into work, you can technically terminate them if you wish. Now, that's never our recommendation because we have valuable team members and we work hard to train them and bring them on board and so on and so forth. But I think my thought on that is that it comes down to communication more so than anything else. Doctors, sometimes, even with my own wife's in her practice, she has so much information thrown at her, right? From the ADA, the state association, her specialty throws her information. And then there's groups all over the country, right? We're doing this right now, right? With the Profitable Dentist, when there's other organizations. But how many RDAs have access to all of this? Right? Yeah. How many hygienists have access to all? Are they even thinking about listening to these webinars, or are they at home doing other things? And so my point to that is that there's a lot of information that you have as a business owner that your team does not have. And so their fear may be based out of that lack of information. So the more we spend time, discussing with them, the more we spend time educating them on all the things we are doing, the better, the better that is, right? Because if they realize, oh, here are the things the doctor is doing to take care of me, and I see it's not 100%, but it's 100% of what he thinks is valid or she thinks is valid. And by the way, this also meets the guidelines of OSHA and HIPAA. Then suddenly you start to see that people's fears go away because now they're not as concerned. But if they go in and they're you're just going to turn on the lights and everything's back to normal. People have those fears. And Steve, I'm sure you've seen the media, I think in Tennessee, in Orange County in California, in other areas, hygienists are revolting against,
Right.
coming back to work, and they're going to the dental board saying, don't make us go back. And, rightly or wrongly, depending on how you fall on it, those are real fears and real concerns. And I think some of it, you might be able to overcome by showing all the things you're doing. Is it risk-free? No, but nothing in life really is risk-free. So all we can do is try to minimize it as much as possible. And for some people, that's enough. And for some people, it's not enough.
I think in my earlier conversations, I think the thing you don't want to do is say, listen, we're over it. I just read an article that said, 96% of people who get it have, comorbidities, and you don't, you're not diabetic, and you're not, you don't have heart disease. So it's okay for you to come back. What you don't want to do is get bogged down into the clinical piece of it's okay to come back. Would you agree with that?
Oh, 100%. Because
a million miles from that.
Yeah, exactly. Yeah, stay away because here's the reality, right? We have seen severe cases of folks with asthma, being susceptible. People with HIV/AIDS who don't talk about it. People with diabetes who don't talk about it. I mean, all these things are immunocompromised problems that could lead to a higher risk person. You want to try to stay away from that if you can, just because it starts to open up a can of worms that you're not really ready to. Now, I will make one more point, Steve, which is that the Department of Labor came and said a couple of weeks ago, they said, look, let's say you do have an older employee. Let's say you do have a pregnant employee. Let's say you have somebody who has diabetes or asthma. You cannot prevent them from starting to work, even though that they are in a higher risk category.
Okay.
So think about that for a second. That's really interesting. They can stop, right? They can say, look, I'm not ready to come back because here are my things. But as an employer, we can't stop them from starting to work. And that, that's where the waivers, and on our resources page on HR for Health, we have waivers for employees, we have waivers for patients that, for people to print and sign, and there's no strings attached. It's not just for our customers. It's just available to everyone. And you can just use that, and that, does it have legal protection? It's better than nothing, but who knows whether there's real protection in it, until it gets tested.
Again, it's back to your duty. You've done something instead of nothing.
Yep.
And if you believe that somebody who's pregnant and with diabetes shouldn't be working, and they insist on it, it's probably good to at least have that piece of paper that says, listen, we discussed it. I listened to her concerns. She told me, she's okay with it. Here's our, we both signed it. Yep. And again, it's at least something instead of nothing.
That's right. That's right.
So kind of as we get close to the end here, I wanted to throw in the second group of people who, gee, I don't want to come back. I'm afraid of the virus, but I'm also making $1,500 a month more by staying home.
Right.
And then there's sort of the quasi, you've got some who, I mean, really right now, no kids are not in school, and you might have an assistant or hygienist that, they have no support system. They have 3 kids at home. They can't come back to work. Any rules or, sort of boundaries we should watch for or stay, kind of stay close to there?
Well, with unemployment, it's a real thing because a lot of people are making a lot of money being on unemployment right now, and sometimes much more than working in the office. And this is not something that would normally be available, obviously, to them, but the federal government has come in and really kind of subsidized that and made it really a powerful thing. The thing that I think employees have to remember, and you as the business owner may have to educate them on, is that as soon as work is available and they say no to that, you have in many states the obligation to notify the state that they said no to the position. And at that point, the state will cut off their unemployment. And a lot of employees don't know that. They think they can stay on unemployment forever, and the reality is they really can't. And so unemployment sends letters and all these things saying, have you offered a job back? Did you do this? Did you do that? And you have to answer it truthfully. And so when you do, then it gets cut off. And a lot of employees don't know that. So I think education is a big part of it, Steve.
The extra $600 a week, I think that only runs through July. Am I right?
Yeah, that's right. 13 weeks. Yep, exactly.
So it could be, it could be 90 more days. Yeah, 90 more days for somebody to sort of ride it out. But
that's
maybe,
right.
You said it early on, communicate. There's a little bit of communication. And I have to think as you ramp back up, if there is a, your best assistant or your best hygienist and they really want to come back, but, they have 3 kids at home and we're still sort of in this mess. Maybe they're one of the last ones that, come back.
That's
Maybe
right.
you sort of move it in the end and say, listen, I understand you have this situation. We're going to see how it ramps up. And, I expect it to be 2 weeks, 3 weeks, 4 weeks. But I'm going to call you, every Friday and just check in. But about 3 weeks from now, we need to be working on that long-term.
That's right.
Is that a good way to?
That's a great way. Yeah, that's a great strategy.
No rules about who I bring back and when and how and any like that I got to worry about.
No. I think as long as you're not discriminatory with them, as long as you're focusing on bringing them back the way you just described, and educating them and communicating with them, you should be fine. Those are the keys that are usually missing.
Okay, awesome. Ali, so we covered a lot. I got a lot of notes here.
Good. Yeah, that was fun.
Anything that's jumps out. This is your lane. This is something you do every day very, very well and have for a long time. Anything that a practice owner is sitting around, they've got a date maybe 2 weeks from now, 2 Mondays from now, and are starting to realize it's getting real. Anything that we haven't covered that they should make sure is on their short list?
Yeah, I think we hit on a lot of very important things. We've got a lot of resources on the HR for Health resources page. So, there's videos, Q&As. There's a PPP calculator, Steve, that we created to help people, kind of navigate it themselves until they talk to their CPA. So there's a lot of resources out there, of course. What I would say is a couple of things. If the audience texts the word dental 2020, so it's one word. Actually, let me make sure that's the right one. I think it is, but
I'll make sure it gets in the show notes. And
yeah, dental 2020. If you do dental 2020, if you text that word, one word, to the phone number 44222. You'll get a text message back asking for your email. And then once you give your email, you get a whole host of resources, including how to hire the team back on. And then there will be links to videos and the calculator and a bunch of other things, all free. There's no strings attached or whatnot. But I think that's a good place to start. And then if you want, to get your HR house in order, because this is the time for HR to thrive and shine, is contact me or somebody at HR for Health, and they'll walk you through how to get compliant really easily and inexpensively and quickly. And that way you don't have to spend thousands and thousands of dollars on employment manuals and this thing and that thing. You can just get it all in one system. But I think the core is communication. I think the core is making sure your HR house is in order and you've got a strong foundation, and then having a real plan as you kind of approach your opening day with regard to, HR protocols, hiring, all those things. And if you do all those things from our perspective, you're in really good shape.
Good. I had somebody text me while you were saying that, or a message said, is that your toolkit for coming back? Or is that a different?
Yes. Yeah, we have. Yeah, there's a toolkit for coming back. Exactly. Yeah.
Okay, good deal. And they can get that at Dental 2020 to the number 44222.
Exactly.
Awesome. And again, we'll make sure if you didn't have a pen handy, we'll make sure that that's in the show notes. So
awesome.
Lee, I appreciate it. You've been like,
thank you.
A lot of times we, have good conversations. And in this case, I've got notes after notes after notes. And, and I think a lot of practice owners are in that same boat. They just, they need punch lists. They need things that are real. They need things they can do where they don't feel like they have to hire an attorney. They can turn to somebody And so that's what I wanted to do with this series. And I really appreciate you coming on and sharing what you guys do very well.
Well, thank you. I appreciate you, and thank you for letting us talk to the audience. You know, a big part of what we're trying to do is educate, because it's the easiest way and the easiest path to compliance. Because let's be honest, I mean, at the end of the day, we all want to get back to normal and focus on our patients and whatnot. And this is just a way of making sure that is seamless once everyone opens up. So I appreciate you very much, and
Thank you.
Thanks for spending the time today.
Well, what do they say? Rising tide lifts all ships. So,
Yes.
and I think, and you know, you as well have been very generous with what you do. And I think what has come out, what has become obvious to me in this dental industry is all the people who do sort of what you do, and, you know, it might be finance, or it might be treatment planning, or it might be whatever, have been very generous with information and tidbits and free resources. I think for that same reason, just to get everybody back up and going,
Right.
You know, then we can see what it's going to
exactly.
But it's kind of inspiring. So
exactly.
Awesome.
Wonderful.
Practice owners. Yeah. Thank you for tuning in again. Ali Oramchian, HR for Health. And we'll make sure the link is down below to get the toolkit for coming back and resources to reach out if you'd like. And so with that, this has kind of been I think our inch wide, mile deep HR episode. So I appreciate that a bunch too, Ali.
Thank you.
So practice owners, hang in there, and it's getting closer, getting ready for coming back stronger. So with this, we'll wrap it up until next time. See you guys. See you, Ali.
Bye-bye. Thanks, Steve.